to local health clinics, and that their insurance is accepted by those services, that they have safe housing and reliable transportation, that they have social networking and ability to rely on the community for when they're going through hard times, things like that. Also, job security, food security, things like that. These are all important because we want to make sure that when people are when they have these factors in their lives, their health outcomes dramatically improve. And so when we talk about reducing health disparities, addressing social determinants of health is one of the best ways we can help communities increase their overall well-being. So with TennCare, we serve the Medicaid population, and we are interested in and investing in this work because we understand that these non-medical determinants affect health before a patient steps into a clinic or hospital and will continue to have effects on their lives even after they leave. So when we think about health, we need to understand that health starts before illness. It starts in our communities, in our homes, in our schools, where we work and where we play and where we worship. And so that's why TennCare created the Health Starts Initiative to help members with health-related social needs, or HRSS. TennCare created a long-term vision of how we want to address these needs in the Medicaid population, and that's to have all members eventually screened for social determinants of health, which is an assessment tool, and have their identified needs met with community resources. So to achieve this vision, we identified interconnected work streams in our current health ecosystem that overlap between the MCO model of care, our provider care delivery, and the network of community-based organizations, also known as CBOs, that provide resources to those in need. We realized that we could implement technology to streamline some of these work streams in a scalable and sustainable way. And this led to the Tennessee Community Compass. And so the TNCC is a technology platform that connects Tennesseans to community resources in a way that provides consistent care and does not hinder the daily activities of providers and care managers. TNCC is powered by Find Health, which is our vendor for this system, and is intended to help close the loop across the state. And so when we talk about the functionality of TNCC, we first start with the member screening and referral initiation. So what happens is a MCO case manager or a provider or another one of these partners will screen a member for social determinants of health and their health-related social needs. And so, depending on what type of screening they use, they might have it embedded into their EHR or their CRM. And what ends up happening is, the member goes through the screening, and then if they identify as positive for maybe having a food need or a job need, or provider can initiate a referral within the Find Help system. What then happens is the CBO will then determine whether they can accept the referral or if they can decline. They can decline based on scarcity, or if they don't feel that the individual is qualified to receive services. But once they do accept, stakeholders then can monitor the referral progress and closure status. So they can reach out to the member, say, are you still interested in getting help? The member can reply yes or no. And then the CPO can then say, oh, okay, if you want to come to our food pantry, or if you want to check out our site for job opportunities or things like that, the member can then respond based on their wishes. So we want to make sure that the member also has autonomy when they're receiving healthcare. There's also the feedback loop. So CBOs can provide feedback on the outcomes. So they can say, well, the member received the help, or actually the member declined to get help. And in this way, we close the loop and make sure that we have an ending to what happened with this referral. There's also two components about data integration. So there's data integration to make sure there's a secure member exchange, data exchange between TNCC partners, MCOs, TennCare, and then we also have something called coalitions. So we make sure there's also system permissions by coalitions to ensure data privacy and control. I'll talk briefly about coalitions just for the safety of time. We're just going to briefly talk about it, but essentially coalitions allow for separation of workflows and data for each managed care organization. So WellPoint, Blue Cross, UHC, those types of things. And essentially, if a care coordinator is part of a coalition, they're able to view and refer within that designated coalition. So In terms of members needing to join, they have the ability to opt in, and that they can have a standardized consent process, which again takes some of the burden off the MCOs and providers. And so with this platform, our vision is a couple of things that we want to see. We want to see expanded CBO partnerships. We want to incentivize CBOs to join this network, and we want to support their mission. They're doing great work. And so providers and the MCOs come alongside, and sometimes we incentivize them through milestones. We'll talk about that later. We also want to connect members to their resources to ensure timely referrals and loop closures across all these different partners. We want to have a unified system, right? One single integrated platform for care teams to address social needs. And we also want to have a data-driven impact. Through the coalitions and through our other reports, we collect standardized, meaningful data to measure outcomes and improve care coordination. Our big goal is hopefully this type of CLRS, Tennessee Community Compass, can be a statewide CLRS, that it can be adopted by multiple state agencies, and that we can have this system embedded into the workflows of anyone screening for social determinants of health. And so we launched this on March 31st, and during our phase 1, we had just the MCOs and our provider partner, West Tennessee Health. In phase 2, which is going out about Q3 of this year and into 2026, we are actually having TDH, which you'll hear about later, and the Council of Developmental Disabilities joining. We also have a couple of other provider partners, UTMC and patient-centered medical home and behavioral health VBP providers as well. So it's really exciting. We're seeing some great progress in phase 1. We're really excited to see what we can do in phase 2. I get to share with you some of the data so far from phase 1. So from launch, we've had about 24,000 assessments in the Find Health platform, with about 18,000 seekers referred, over 6,000 referrals submitted, and that coordinates to about 2,000 seekers getting help. In terms of referrals with responses, we've seen about 1,200 referrals, and then in terms of the actual closed loop referrals, we're about a little bit more than 940. And so this is just within the first 5 months. And so, and again, this is only with our phase 1 providers. And so it's a really great start, and we're hoping to see it grow, especially as we get more provider partners into it and different other state agencies as well. And so I'll share a little bit about community engagement. So across Tennessee, you can see the breakdown by verified programs within the system. And when we talk about verified programs, we mean programs that are claimed by the CBO who are actively deciding, hey, we're going to respond to referrals. And so we have about 230 CBOs added to the network since launch. And this has really helped us, especially with our focus CBO networks. And so focus CBO networks are essentially, we have two. One is the trusted CBO network, which is CBOs are required to have the referrals turned on. So they're actively accepting referrals and must opt in to join the trusted network. They also receive additional training on how best to respond to patients and their needs, so that we can have a good response rate and a closed loop rate. And as you can see from the data in July, the response rate is about 87%, with a closed loop rate of around 71%. That's really, really fantastic. Across all CBOs, that percentage is around maybe 16% for closed loop rate. So the fact that with this trusted network, we're seeing 71% is really, really great. And it speaks to the nature of what happens when MCOs and providers partners with these organizations to help those get their community resources. With the incentivized network, in addition to the requirements of the trusted network, these networks also have higher standards for response rate, closed loop rate, and they receive incentivized payments based on milestones they hit. So making sure they stay logged in, every so often, making sure they're responding to patients in time, making sure they're closing out referrals. And you can see the results of that. The response rate is almost 100%. Which is something that we're really, really happy to see, especially as we're only just starting out with these incentivized programs. We have 11 signed right now and about 36 in progress. The goal is to have 60 of these programs across the state. So these are programs that will be always responding to referrals, making sure that patients get what they need. And they have a closed loop rate currently of about 87%, which again is really, really fantastic. One thing I forgot to mention, even though this is something that we designed for 10-care members, this can be used for all Tennesseans. Part of the Find Help platform is that it's an open resource directory, and we make sure that all the programs listed on there are either free or reduced cost. So even now, any of you could go onto this platform, search for a need, and then find a CPO that matches with your health related domain. So you can see here on the left the most commonly searched terms in Find Help right now. We have help pay for utilities, food pantry, help find work, help pay for housing. In terms of the searches by domain, housing, food, and health take about 80% of all the searches. And there's currently been about more than 2 million searches since launch, which is really, really fantastic. And we want more and more people to use TNCC, not just 10-care members, but all Tennesseans, because this is a great tool that can really help with their needs. And so we would love to hear from you, and we would love to connect with you. We are trying to find more and more CBOs to join the network. We're trying to find more and more providers who would be willing to screen their members and be part of this really growing movement. And so I'd like to take some time and actually show you a demo of the site, if technology works with me. Technology won't work with me. Perfect. Okay. So this is the Community Compass website. And so, like I mentioned before, zip code is so important for predictors of health, but you can also use it to find resources connected to you. So can I get a zip code, please? Just someone shout out a zip code. 3705. 38035. Sorry. 38305. Sorry, it's hard to hear, but so you can search for programs based on the zip code. You can also search for a specific need. I need help with food. I need help with work. When you search for by zip code, you can look up by the domain. So we have food, and these are all the subdomains under food. We have housing, goods, transit, health. Money is usually like, help me pay with utilities, things like that, vouchers. There's different types of care under health, education, work, and legal. So for example, if we were looking for food, say we want to find a food pantry close to us in the zip code. It's going to verify that we are human. And then it'll give us a list of close local food pantries. And so these are the resource card for each program. It'll tell you the program name, who the program is run by, the last time this information was reviewed, and then I'll give a short description of what this program is. And what's great about this is you can find out, what's the eligibility, what's the availability of this program, what type of language does this program offer in terms of who they can help, and what's the next steps. Do they have a website? Do they have a Facebook that you can connect to if you like? What things are required of you? And so really, this gives a deep dive for individuals who are confused about, there's so many CBOs out there. Which one is right for me? Which one's close to me? We can take a look at the map, or you can also filter out by personal program and income. And I really like these because they go really into depth. So they can be broken down by age group, by income, by household. If you're looking for specific programs, there are ones where you can call, visit, and by income, there are thresholds that you can type in if you have a certain idea in mind. And then you can apply on their site for some of these other programs. You can, look up next steps. The programs themselves will list the best ways to contact them. For some of them, you can actually refer yourself. I don't see any listed here, but there's ways to refer yourself, or if you know someone in need, you can refer them through the system as well. And so it's a really great tool. And like I said, we're only just getting started. We're only 5 months into this. And as more and more people adapt it and use this system, we're really hoping to address some of the social determinants of health needs in Tennessee. So that is the end of my presentation. Do we have any questions? Oh, yes.
No, you're doing good.
Well, thank you for doing this. And two things. Is there I'm assuming there's a website with the CD most on the level, on the level.
Yes. So
Can you show up this?
yes. So the question was, if a CBO wants to join this network, if they're interested in joining this platform, how did they do it? Well, they could reach out to us at TenCare or on the site itself. If you go to support, oh wait, no, this isn't right. Yes, it's somewhere. Yes, here it is. It's suggest program. So you can suggest yourself, or if you know a program that's not getting a lot of traction, but you think would be a great fit for Community Compass, you can add it here. And this is something that's monitored on a 24/7 basis by Find Help itself. And so they will respond and let you know, maybe this is already something that they've tried. Maybe they've already reached out to this community based organization, and the community said, hey, we don't have a lot of staffing right now. We don't have a lot of resources right now. This is something we'll pass on. But there are many CBOs that, we just aren't able to find, we try to partner with the MCOs. We try to partner with all these providers, and they provide a list of, organizations they have strong relationships with. But we always want to hear more about programs that you think would be a great fit for Tennessee Community Compass.
Second question. It's happening. What the requirements? So, scaffolding. And
Okay. So the question is, could this platform be used to essentially weaponize this information against individuals? Is that correct? Amen. Okay. I would say that the information is pretty secure. We go through these different channels and different reports to make sure that even among MCOs, right? MCOs can only see their own members' data. We don't want to make sure that a provider can see, the social determinants of health needs for a patient that's never been to their clinic before. And so we take a lot of measures to ensure that the data is segregated based on what the MCOs are wanting to see. And in terms of weaponizing this data, I don't think that's something that can be done. Unless you have a specific scenario in mind, I'm struggling to think of something.
yes.
Dangerous statements. Just that there's always potential. For all the step that's for the name. So it's just the question part.
Oh yeah, for sure. It's a great question. Cybersecurity in terms of like PHI and things like that is something that we're always cautious about. We always want to side on the air of, making sure that people's information is protected. For the most part, when when the providers are providing the screenings in their EHRs, or the MCOs are using their care management platforms to screen members, we make sure that when they're connecting to Find Help, it's either through an SSO or an integrated launch or API launch or something like that to make sure that they are safe in their data connection. We make sure that we're all up to date on the fire operability and those type of things. And so in terms of safety, obviously I can't guarantee anything, but we make sure that member data is secure.
In regards to certain information that you wanted, you guys have certain beliefs, so community comments, that's the end of it. And also anyone can access the platform of the school. Is there any promotion or any marketing around only using the community compass? Because you can just sit inside and find help.org and look up your zip code as well. And put it. And to that point, how are you able to track for your trusted network?
Sure.
And then you like the community company, attach with NPO your coordinator, and I use the link and I do put the trusted networks. How can capture that without being on the community company?
That's a great question. So the question was, how can you track essentially when someone is using the community campus website? They're not, getting a screening through a provider or an MCO or through another partner. And then why would you use the TN Community Campus website when you can also look up these resources on FindHelp? And I'll say for the latter part, the Tennessee Community Campus has been curated to specifically choose programs that we know Tennesseans are looking for. With FindHelp, they have federal programs, they have state programs, they have multiple states that are involved with their platform. Tennessee Community Compass is specifically for Tennessee. The featured programs that end up going at the top are those that we know are responding, that have the referrals on. This is curtailed to what we've seen with TennCare members and with other recipients within Tennessee. And so there are other instances of this website. TDH will have their own instance when they go live, but it all gets tracked through FindHelp platform. So we still see the data, even if someone outside of Tennessee is trying to get, a food basket or a food delivery from one of these pantries or something like that, we'll still see that data, or at least FindHelp will see that data if they're not a TennCare member. In terms of sorry, what was the first part of the question again?
How will you be able to catch that referral in not?
I'll say we can't. So for example, if someone were just to look up, even a TennCare member, if they were to look up, hey, I'm looking for diapers or something like that, right? And they don't create a profile, which is optional, and they don't go through a provider or get a screening or anything like that. And they just use the website, look up a resource, maybe they'll call them up and say, hey, I'm interested in getting diapers from this organization. We don't know if they are, a TennCare member. We don't see their data. We don't see their profile either, embedded from the EHR or the CRM. But honestly, that's the way we want it, because we want people to have that autonomy to choose. They can go through their own independent account, or they can go through a care provider or something like that. In terms of again, that data security, right? We don't want, someone's information being pulled up randomly just because they're searching for something within the system. Does this limit, our data metrics that we can track? Yes. But at the same time, the most important thing is that people are getting connected to the resources they need. That's why, again, this is available for all Tennesseans, not just for low income or for Medicaid patients or anything like that. It's for anyone who needs help.
Susan?
Not necessarily. We asked.
Will you repeat for the online?
Oh,
paper?
sure. Sorry. The question was, is there criteria for a CBO to join? I say not necessarily, because generally we want CBOs from all different types of backgrounds to join. We have, CBOs who are focused on vision and focused on transportation and food and things like that. There's no requirement, but we do prefer that CBOs be able to respond to referrals, right? There's no point to this platform if, we send a referral to a CBO and then they don't see it, they don't do anything with it. And then, there's no closing of the loop, right? So generally when Find Help and we have another organization called the Rural Health Association that tends to, find where there are deserts in terms of resources or finds smaller CBOs that be willing to join. They often have conversations about, hey, is there someone on your staff who will be able to monitor this, who can respond to referrals as they come in? And so there's not a main criteria for that, but again, we're trying to find CBOs who are willing to engage through this network. Yes, that is one criteria, I guess. Yes, free and reduced. Direct service? Yeah. Sorry, what do you mean by direct service?
Uh. Or.
Oh, yes. Yes. Sorry, I was confused by what you meant by that. Yes, there's no like middle organization where you go through them and then you go through another organization or something like that.
Can you help me say thank you to Paul for joining us? Thank you so much. Right. And in that process, my friend Jen Trail, who works with the Office of Strategic Initiatives, at Department of Health, is joining us to talk about part of their roles. So let me get their slides started. So the rest of our presenters today will be from the Department of Health, and I will let them kind of tell about what they do. Jen has been a partner for a while. So we've always tried to work her into our work as often as possible, and actually was one of the founding members of ACE Nashville, I think, if I remember correctly. So her grassroots work goes way back before her state work ever began. So we're thankful for her. All right. I think, oh, look at that. I'm just pushing buttons like, and that should work. Okay, perfect. Let's give you this one just to make sure. Yeah.
Yes, I am one of the saplings that came up with building strong brains. It's so nice to see you all.
Hey, I will tell you that our online.
Do I need to stand here? Oh, it's gonna be so hard.
I can maybe move it out a little.
No, that's all right. That's all right. Hey, everybody online, don't hold me accountable. I think we're tying a bow on this meeting, so hopefully we can get you out to enjoy fall while it lasts. So yes, my name is Jen Trail. I'm with the Tennessee Department of Health. Disclaimer, I am not an expert in closed loop referral systems or APIs. Ask me about IPAs maybe, but I am the smartest person here for sure. But what I am, and just I'm kind of starting us off from the Department of Health lens to lay some context and level set a little bit about how we're trying to approach as a department a more comprehensive approach to care in our local health departments. And so the role of my office is strategic plan facilitators, shepherds, connectors. And so I'm kind of starting us off from that lens about how our department has prioritized this issue in our strategic plan, and how we're going about a collaborative approach to try and make it happen at the systems level on down to the direct services that we provide. So just
quick, some level setting here. We do have a departmental 4-year strategic plan. We're kind of in the middle of it. We're like a couple years in now. And we started with this vision to better coordinate state resources to address social drivers of health in both clinical and community settings. And I think if any of y'all have been part of strategic planning in your organization, you know, you're kind of like, you're shooting your shot, you're dreaming big, you're setting a vision, but then you're kind of like, oh crap, we actually have to figure out how to do this. So that is part of my job, is looking for what opportunities existed at that time that we could leverage to make our vision happen. And one of those opportunities at the time that we wrote this objective was around the same time that the recommendations came out from the Governor's Rural Health Task Force that included a focus on closed loop referral system supports, using TennCare's 10Care as kind of the driver of that. Another opportunity we saw were for groups like this, the Resilient Tennessee Collaborative. We heard it coming up in conversations at TCCY, and then of course with our partners at TennCare. So we said, aha, opportunity. Another opportunity we were looking at was the ability to use some funding available to us from the CDC's Public Health Infrastructure Grant. And so we've actually been able to move some support for a closed loop referral system into our budget through that grant. And this is kind of a sidebar, but also very related. We've established and been able to grow the programming and number of staff that provide a navigation or coordination service with our local health departments, and also a team focused on navigating folks through dementia care, so specifically. And then we also identified that there were very siloed but programmatic approaches across different divisions and offices in our department. And that acronym soup that you see there is Family Health and Wellness, Communicable and Environmental Diseases and Emergency Preparedness, Community Health Services, which oversees our local health departments, and the Office of Healthy Aging. So all of these divisions had some kind of a program where they are doing these like navigation services. And then we had a ton of internal interest in our department to better centralize support for this work. So we formed a steering group, a collaborative steering group. We call it the Comprehensive Care Work Group. It's very collaborative. Again, the acronym SOUP are all the divisions and offices that are represented there. The Office of Health Planning, Family Health and Wellness, our Division of Health Disparities Elimination, Community Health Services. Again, they kind of like supervise all the local health departments across the state that are not metros. Our Office of Primary Prevention, and then OSI Strategic Initiatives, which is my office. So we kind of got everybody together and facilitated some visioning and planning around the question, how can the Department of Health better address health-related social needs? And we came up with these two focus areas. One was trying to implement a closed loop referral system. And I'm going to actually, in a minute, pass that focus area off to some folks who can talk more in detail about that. But just in the spirit of setting some context, that's not all we're doing. We also identified a need to provide more centralized support for those people providing the services across the state for the department. And that work is being led by Judy Connect, who's actually here, so she can keep me honest and answer any questions y'all have about that. So just a quick overview about that support. First of all, we actually found, and I learned this from Building Strong Brains, the importance of establishing common definitions around certain words where there's, you ask 3 different people, they might have 3 different definitions. And we found there were a lot of different definitions about what navigation meant. And so we kind of decided to work with this definition. It's basically anybody who connects individuals to resources in their community. So maybe they're screening, they're collecting data, they're identifying the resources, they're providing the referral and providing some kind of a follow-up there. So that was really helpful actually when identifying what and where to apply support. And through the navigation coordination initiative, Judy here has been leading efforts in these 2 kind of areas. One focused on the centralized and systems support for the department, and then one on reducing silos and fostering collaboration among the navigators themselves. So the goal for the system support was really just to start with documenting what do we have. Nobody had ever really done that before. We had, and in doing so, we identified there are 14 different programs and well over 200 navigators staffed by or funded by the Department of Health across the state. And these are all, they all have, you know, different processes. They might focus on different populations or different needs. They're reporting up to different departmental leaders. Okay. But nobody had ever really inventoried these things into one place before. And Judy and the folks supporting that work took it a step further to develop a directory within our SharePoint. So you can actually go and find all of the people working within these various programs providing the navigation services. Not sharing online.
Mhm.
Good.
There we go.
There you go. All right, so for folks online here, you can see all the different programs through the Department of Health that are providing those navigation services. So it's quite a bit, and nobody had ever really collected them in one place before. For the navigator support, and then Judy, keep me honest, so and chime in if you have other things you want to add. But really just the immediate goal there was bringing them together to have some peer support. We established a learning collaborative for the navigators in the Department of Health. And they just had their first meeting not even a month ago. And so this is a place where they can just come and connect with each other. They can have the opportunity to get information from central office, but also be able to share lessons learned, share processes, challenges, best practices, and so on and so forth. So really trying to build that network of peer support and collaboration so that they feel less isolated doing the work that they do. So that is our navigation work. And we'll save questions for the end so we can make sure to pass the mic around. But the other focus area for this steering group has been supporting that closed loop referral system and partnering with TennCare with the Find Help system and piloting some of that. Dr. Hector Carrasco with our Family Health and Wellness Division, he couldn't be here today. He sends his regrets, but I know he would love to take questions later if you have them, but he was able to recruit Joanna here, who's going to come up and talk about the Find Help pilot with the Department of Health. And hopefully between our group of folks, we can help answer your questions. So thanks again, y'all, and I'll pass it to Joanna for the next piece.
Hey, hello everyone. I'm Joanna. I am a clinical applications coordinator and I oversee the case management data entry system for our evidence-based home visiting programs in the Family Health and Wellness Division. And so I'm the messenger today. So I'm presenting on behalf of Dr. Carrasco on this Find Help project that took place last fall. I did not particularly participate in this, but I've been teed off by some of the great context that Jared provided and that Paul already shared. So a lot of these slides we're actually going to be able to kind of just move along because they've already been noted on already. So as Jen mentioned, we're going to kind of tee off and talk about that closed loop referral piece and how PDH is taking on this piece of navigating patients with health related social needs. Okay. All right. Let's see. So as Jen mentioned, there are a lot of navigation related programs at TDH, and a lot of those could be anything from breast and cervical cancer screenings that are connecting women to screening and diagnostic services. It could be our evidence-based home visiting programs that are connecting mom and children to services. It could be viral hepatitis navigators or Healthcare Connect navigators that are connecting families to TennCare. So there's quite a bit of range of programs that are involved here. There also can be very small or very large. Our evidence-based home visiting work course, is pretty large, reaching almost 400 home visitors across the state. And so really thinking about, okay, what does that look like and what are they actually doing? And so they're linking these families to different resources. And oftentimes some of these programs are linking them to very specific resources. And then you have on the other spectrum, evidence-based home visiting or CHANT, our care coordination model, connecting them to lots of different resources. But ultimately, all of these programs have the shared goal to improve that care coordination and reduce those unmet needs. And this is where that strategic plan piece kind of comes in. And it's why TDH became interested in finding a platform that can make this work more consistent and more effective across the programs. And so kind of TN find help. As Paul shared, I think on my presentation, what I was given, there's that findhelp.org website, there's a community compass, tn.gov website. There's lots of different ways to access this. One of the reasons why we put Find Help here is to make sure that you guys are noting that there is another Find Help Now site that is connecting families to like substance abuse and treatment providers in real time. So if you're going out to explore about more and learn more about Find Help, we just recommend that you visit the Community Compass tn.gov website or the Find Help, and don't get confused with the Find Help Now piece. So that's just a little note. And then kind of trying to understand, how did Tennessee come to land on Find Help? And so I wasn't a part of that strategic development piece, but as you can see here, there is a growing network of states and organizations that are using Find Help to power their closed loop referral system. And so on the left, you can see that there are several other states that are already using Find Help, including Pennsylvania, South Dakota, our neighbors, Georgia, Indiana, several others. And so one of the key pieces that makes these work, and we are modeling that in Tennessee, is that several of these states are partnering with Medicaid agencies, public health departments, or other state level entities to really improve that care coordination and social need of referrals. And so on the right, you can see who Tennessee is partnering with in this Find Help process. So that includes TennCare, obviously, Blue Cross Blue Shield, several of the hospital organizations, and many others that are kind of going to make this piece, as they have all mentioned, is it needs the partnerships to make the referral closed loop piece work. And so having that leverage with those other state agencies really helps improve this. So one of the pieces that Paul kind of, he had showed the search part. Now, if our care coordinators and the pieces from our providers have logins, and which allows them to see these dashboards that show them that connection to the resources. So you can see that each row here represents a different applicant or client or member that is being referred. You can see a column for referral statuses and see when those were last updated. And so that's the closed loop piece that is making this, we're not just sending off the referrals, but we're seeing that support and tracking whether they received those services. And so adding to this data is a little bit different than Paul shared, but very in same line. This is just looking at the last 3 months, but really the point we're trying to make here is that there are a lot of different programs listed. So this is specifically in the last 3 months that were added. So it means that services are available. And then that 80 new programs claimed in the last 3 months, that's showing that organizations and providers are taking ownership of those listings, which in turn then helps fuel that closed loop piece. So if those are not claimed, then you don't have that closed loop part. And so seeing those numbers and really seeing that trajectory over the weeks, it's not just a one-time spike, it's consistent like productivity across the board. And we're really seeing it's a good sign of the infrastructure that it's maturing. Again, it just started, 5-6 months ago, and this is just data for the last 3 months. So really seeing that robust piece as it's just launching. And so then what does this look like specifically in Tennessee? Like, obviously there's lots of different searches across the place. Are people even using it? The resources may be there, the referrals may be there, but are people searching? Which again, Paul provided some data. We can see here, like just in Tennessee in the last 3 months, we have close to over 35,000 searches per week, and then over 400,000 total searches. And then the cool piece here that kind of the point is that this is not just the same person going in every second and searching for the same thing. There are close to 15,000 unique users that are making those searches. So again, the more people that are in it, the more robust the closed loop piece becomes. And so then again, Paul also shares some of this data. We can move along. A lot of the main pieces really thinking about, okay, what are they searching for? Because I think the point here to make is then this helps us understand. So as Paul had mentioned, food and housing are some of the big ticketed search items. This helps us understand what Tennesseans are looking for. So then the work that comes from that data is then we need to make sure that we have providers, community partnerships and networks that are responsive to those needs. Because then if our Tennesseans are searching for housing, but there is no housing resources on the platform, then are we really providing that support and need in those resources? So I think this data is really helpful from a data epi and data minded person. This is helpful to see what the searches are and then where we need to further improve the community network and support. So then thinking about like, how does TDH fit into the Find Help picture? And so leadership was kind of asked to think about this strategic plan that Jen shared and how do we go about that? And so Jen already described that we had kind of set up lots of different things that fit and made Find Help be kind of the next piece. And so our leadership launched the Champ Find Help pilot last summer. It covered 7 counties, including Hamilton and the few listed here from the Mid-Cumberland region. It included 16 care coordinators in that Champ program. And it was only for 3 months. So the data that you're about to see, keep that in mind. It's only for 3 months. And in that process, in that pilot, it was really important to look at different outcomes, including the number of searches, like were they using this, the number of referrals, what's it doing, what was intended, and looking at different qualitative methods, including the in-system analytics as well. So as we think about the Champ process, for those that aren't not specifically know, it's very similar to some of the other things that have been shared in that navigator process that Jen just shared. Patients identified, they're screened for specific social needs. Those needs lead to specific pathways of like service and need for referral. They're connected to a care coordinator at the local health department level. And then those care coordinators are responsible for making referrals to community partners or other programs. And then there's that follow-up piece that is there. And so where does Find Help come into that in this process? They come into that piece where the referrals are needing to be identified and made. And then they make the closed loop piece of Find Help then helps with that follow-up, whether it was there before or not. It's adding that layer of accountability and kind of clarity of what we're looking for here. So as I mentioned, they looked at different indicators in terms of searches, referral sessions, and interactions. Searches are just family or people looking for programs, and it leads that result. And then referrals is really the piece that we're interested in making those referrals for that closed loop. So we'll look at some of the data that came from this pilot in terms of, again, keep in mind, 3 months, only 16 care coordinators. In those 3 months, they had a total of 825 total searches. 80% of those did come from the Mid-Cumberland region, noting that they had more counties. And then as you can see, there is some influx. They noted that some of those could have been due to a conference that all the care coordinators were involved with, Labor Day weekend. But as you can see, there's still some steady activity that tells us that they are consistently searching and making it a part of their workflow. And then as we think about referrals, again, this is the piece that we're interested in, is in that time period, they made 190 total referrals. And Paul alluded to some of this, is that there's a category of those that receive responses. So for us, that was 52%. And then of those, like 30% were actually the full closed loop where they had some answer whether the client received or did not receive data or service. And so really here it's just that they are using it for referrals. The pattern tells us that they are kind of in a meaningful way providing those resources to the clients. Okay. And then as we think about the other 2 metrics, again, this is just looking also at interactions and searches, just overall by specific care coordinator. And really the point here, not so much all those numbers, but the point here is that different users are going to use the system in different ways. There are some that have very high sessions, searches, interactions, and referrals. They were categorized as high users. And then you have some that I don't think were aware they were a part of this pilot and have no interactions or zero referrals or whatever that looks like. And so I think the point for us and the key takeaway is thinking about, okay, how do we use this data to then tailor future trainings and support and understand how different people are going to do this, and then really think about that buy-in as you're moving forward in phases and implementation. So again, just how do we leverage that data? And then we looked at different qualitative measures. The 3 specific points that we want to highlight today is the effectiveness in the streamlining of referrals. What did the coordinators think about that? The availability of resources that was in the system, and the ease of use. And so I think, as you can see, it was organized in this Likert scale of not much being 1 for those specific questions and extremely for 5. And in the theme of effectiveness, the general average was 2.73. So, but if we looked at it among high users, you can remember there was quite a stratification between those that actually used it. They thought that it, in a 3.8 average, that the system was effective. And so really thinking about how that plays in again to training. There was some comments about duplication of work or like multiple systems. Again, back to Jared's point of like, how does interoperability come into this? If all of these care coordinators are already responsible for entering these referrals somewhere else, what does this look like? And so how does that diminish the effectiveness in their mind in using the system? So again, something to consider. In terms of the availability of resources, they were at an average of 3.4, and not surprisingly, they noted that dental and housing had gaps, specifically in rural areas. And so again, part of like, how do we bolster up those resources that are in most need? And then in terms of ease of use, that was the highest response with a 4.4 average, really showing that the system itself is user-friendly and the platform can be intuitive and like easily accessible. And I think that speaks to the work of also making sure that this is accessible for families if they're just randomly searching on the platform. So here's a quote. They definitely thought that one of the main things that they pointed out was that not knowing all the local resources, but having something like Find Help that shows you all of that, especially for new staff that are not, I think somebody else made a comment, I think whoever, about like, I think it was a United Way. He said, well, my most like prominent like people that have been here for years, they know right off the bat what the resource is. But if you have new staff, how does this help support that and building that up? And one of the key points that I thought was interesting is that 50% of the users in this pilot, they all mentioned that they discovered at least 1 new resource that they didn't know about before. And so again, driving in that point. Okay. And then, so key takeaways, again, we're kind of moving forward. So trying to understand what this pilot is going to teach us. And again, Jared made a lot of these points for us. So again, thinking about this being an excellent resource for discovering new community resources. That's what they said. And then how do we think about training staff and early engagement buy-in so that this is as successful as possible? And then really optimizing that integration and usability, because if that's not working well with the existing workflows, what is that going to be in terms of uptake from our community partners? Jared also made a point to, we need to make it as easy as possible for them to be able to adopt this. And then they learned based on this pilot in the short, like the small group that they worked with, that a phased rollout would be very helpful. I think it helps also provide additional support and training. But really able to demonstrate that success and really build that buy-in with additional rollouts. I love number 5. I didn't come up with this, but utilizing data and analytics for continuous improvement. The system has a lot of built-in analytics that help drive some of those kind of able to monitor gaps, track referral outcomes, and really evolving. If we're not evolving with the way that the people are using the system, then we're going to lose some of that benefits as well. And then really strengthening that cross-agency and community collaboration, as I've kind of mentioned several times. If the partners are not involved in the process, and the closed loop piece is lacking. And so they need to be engaged in a part of it to maximize the referral outcomes. And so what is next and what happens from here? TDH is kind of now thinking about what do we learn from the pilot and what are the next steps? Jared or Paul kind of already stole the thunder of some of this. But TDH proposed or shared all of the results from that pilot with TDH executive leadership, and they decided based on those findings that they were going to kind of approve a broader rollout of Find Help across the state. Again, following that phased approach, they are going to start with EBHV, some of those programs, some of the community chant workers, and viral hepatitis. They're keeping in mind that programs will launch when they're prepared to do so to ensure that success. So really thinking about that readiness. And here's a kind of brief timeline of what they're looking at, noting that go live for some of these kind of, now it's a pilot V2, starting in October by the end of the year, of introducing these TDH programs to the Find Help platform. And I think to wrap us up and really, I think is a good wrap up for the whole themes of the meeting today, is that the vision falls back to that strategic plan of establishing a coordinated statewide system with this no wrong door piece, that no matter where the family is going, what program they're interacting with, they're able to get that referral and be a part of that care system. So again, my name is Joanna, but if you have specific questions about that pilot, I was not a part of it, but Dr. Hector Carrasco was, and now him along with Dr. Miller are leading this next phase of the rollout for TDH. And then Tiffany Tuckto is our community engagement lead. She is online if there's specific questions about how TDH will kind of plan to engage in that way. And then Paul will help me answer any specific Find Help questions, but
Yeah, how do you relate the county for the pilot? See Joanna looking.
I did not select the county. So the question is, how are the counties selected? I think they did, based on what we are doing now for the phased approach, which I'm involved with, it was this readiness approach of who has the capacity to do this, who is interested in participating, who wants to provide feedback. I think it was presented as like, you can provide feedback of what this looks like if you're a part of this. So I think Mid-Cumberland, based on my experience, is always generally ready, and because they're closely associated with central, or not associated, closely in geographic area, close to central office in Nashville, it is generally an easy pilot place to start with. And I think then maybe they tried to assess some other rural or areas, which is why Mid-Cumberland also has some of those, as well as urban with Hamilton being involved. But I'm not sure. That's a great question for Dr. Carrasco.
I feel like
Okay.
Trail is farming everything.
Okay, great.
Questions on?
Oh.
So you suggest or get entered into community compass. Does that automatically feed into your part constant? To
Feel like there's a lot of growth going to the.
Yeah, that's the Paul question. There was a question in the room for those online that says, if you are a community-based program that enrolls in Community Compass, how does that translate to Find Help? And is that program automatically listed on Find Help?
Here. The programs that end up at the top of the search, okay, are those that have referrals on. Explain these organizations are actively responding to the referrals. For those that are further down, they would have and very happy with Sonic loans. Of course. I was saying, appreciated our piece in order to make sure that staying engaged And beneath that, certain organizations like TDAs anything that like TDH and our providers can do, they can actually feature certain programs. So, for example, you see, they have some organizations that they work with frequently in the past, and they'll provide physical resource cards to members at RTC. Instead of providing those physical resource cards, they can just have them listen at so that when members search for them or their care navigators are looking through the database for what to use organizations to they can choose that. They can also have options to create a favorites folder. So instead of like actively searching, they can just say, hey, I know that this person has they need pension products. I know a great organization that we can ask and help with them.
So where should they go to suggest a program? Should they go to communitycompass.tn or findhelp.org?
You can go to Find Help and go for the Compass. You can also reach out to 10Care. I share the Help Start email and my director Nicola Wise. You can also send the program to me if it's something that you feel really passionate about. I can send it over to Find Help, who work with the team on a daily basis. They're very responsive to adding programs. Again, it might be a program that we've already talked about or have conversations being part of the network. But again, if they are stretched too thin, or maybe they thought, what, this isn't seeming like us right now. There are situations where those CEOs won't be added to the network. And again, they have to be free, introduced, and
The inverse. It will be to be.
So these websites are they're definitely branded, I'll say, they're not the same platform. So Find Help has all these programs still listed in Compass, they're just not featured at the top. So for example, if you are for certain reason in Georgia, right, and take care of it, and you're looking for resources, you can still use Find Help. It's necessary to serve resources in Georgia, even though these programs won't be listed and the Tennessee Compass, the main site itself.
So for those online, if you didn't hear him, the main theme is that both both websites are all connected or in one and the same. They just have different visibility into the programs that are featured and the programs that are available. So the Tennessee Compass one is going to focus on Tennessee specific programs and those that are featured based on some of the categories that Paul talked about earlier.
Therefore, we continue to create common fund. Every education on everyone being one.
I think that question was section for you.
Take on like doors under the five fields. Is there any? That's a good question. So maybe.
So the question is, why do we have multiple links that we can use for Find Help? Why not just have one link? And the answer for that is because we want to provide options for members and patients and Tennesseans who are more comfortable going through, TDH, or they're more comfortable going through their provider or going through 10Care itself. And so the data, we all see the same data on the back end, right? It's segregated by the coalition and also divided by, the organizations like that. So we still see all the information that we need to, we just have different, basically white labels for these different sites. Would it be easier just to have one site? Maybe, but again, TDH has 3 different programs currently that are currently going through phase 2 right now, right? It would be great to have one site, but they also have different needs that they're meeting. And so having those different sites helps with those outward facing questions about, okay, where do I go for this? Well, I can try using this website because I know as part of the CHAMP program, I'm more familiar with this, right? But in the end, they're still getting the same connections to the CBOs that they would if they went through Tennessee Community Compass. They might not be featured as high, right, or at the top, but this makes it easier for Tennesseans or for the navigators who are helping people get referred.
I guess that's the specific program being trained in their specific lane. And so they don't need to know that they're like, they don't need to worry about there being multiple. So like the phase 2 of TDH, we're covering a specific lane, those providers and also the people in that program be in that lane. And then families can search any of them. It doesn't really matter. And so and obviously it's probably even better if they don't get to it about which way they get to it. And then the specific provider customized to their view. So for those pieces, it's easier for visitors to see specific programs that they regularly refer to than what CBO, like the MCOs, their view should be different if they're connecting their members to different things. So on the back end, it's really more for the users, more so less for the families perspective to have these different things.
Incentive program for CBOs, what's involved in incentive?
Yeah,
It's just.
so the question was, what is the incentive program for CBOs and what is involved for them to participate? So for them to be considered as an applicant, they have to ensure that referrals are always on. They need to make sure that they're responding above a certain threshold. The response rate is above 90%. And then in terms of the closed loop rate, we also have a high standard for that. And so the way that it works is they can qualify up to 11K in a year if they meet certain milestones. And so once they hit one milestone, they'll get part payments, and then as they keep on hitting more, it goes up to 11,000.
If you use that 5% from quick, 500 people that, since it's not dropped to 8, so it doesn't matter.
It doesn't matter. But the thing that is great about the incentivized program is because we know that they're going to respond really well to referrals. Find Help and RHA works to make sure that these become one of the featured programs. So say you have a program that just starts as a incentivized, as part of the incentivized network, right? And maybe in the past, it's only received 5 referrals, but it has 100% response rate and 100% closed loop rate. We know if programs like for something like vision care, sure, maybe not a lot of people are searching for vision care, but we can put that at the top when people search for, I need help with glasses or contacts or tests, right? And then they have this organization that's really responsive and is really motivated to help them get what they need. Technically, it's the managed care organizations. They're the ones who are providing these payments to CPS.
What if you don't take it 10 years? Then you still get 11,000.
I don't think there would be a scenario where they wouldn't take 10 care members. Again, these are all programs that are free and reduced. Yeah,
That's right. Historically, find out develop what is a source directory platform. And we roll it up, see that was the function that was added as. So the closing referral system is a new function in this phase of the work. My question is that function on back? Is that function separate from the published. But that's the debate.
So the question was, the closed loop referral system aspect of the final platform is relatively new. They started out as a resource directory for members. The question was, does the CLRS aspect of it, is it baked into the resource directory? Is that right?
Yeah,
Perfect. I'll say yes. So the way it works is, so, you actually know about navigating.
For you. So my, you know, for in that. So that's the program. And then that opens up their then they are it's to them, the people on of the provider until you age their. So I don't know the technicalities behind the stuff, but as far as this would be the.
Is there level of information that goes along with
It is my understanding, yes, that each client will have its own specific data. They've been.
So final question. First two, great. So you said earlier that data is segregated from is it segregated? It's final, basically segregated out of for all those records and programs.
That's right. So Find Help is the central database, and we were talking about like who is able to see all the data. The Find Help is so they're able to see, you know, for CDH, for TakeCare members, for the service providers, and then for the MCOs as well. And the thing is, they have, because otherwise, you know, on the back end, when they're picking up the data, making sure that it's separated out, we need someone in order to be able to administer that. And so the Find Help team, as the vendor for the platform, is in charge of making sure on the back end that all that information is broken down depending on, you know, on which organization is submitting the referral and which data and reports.
If they're answering the referrals, if it says to contact their website.
So it wouldn't say to contact their website. The example I have food pantries,
So maybe.
So- Right, so you wouldn't qualify for an incentive if you haven't opened up to receive a referral through the system. If it says contact website, you are not claim that card. Yeah. So you haven't claimed that card. Therefore, you don't qualify to receive a referral in the system. And the only option for us is we still want to provide, like Find Help still wants to provide the resource to your program, but because you have not opened up to receive referrals, the only thing we can say is go visit their website. So in order for you all to receive incentives, I'm putting dots together that I don't know exist, but in order for you to receive your incentive, you would have to be open to receive referrals. And then we can track if you are answering those referrals. Does that make sense?
Yes.
Okay, second.
Is there somebody local to update? Let's see, because we're also seeing that our lists are in organics. And I'm not gonna lie, I've been here now, that I'm to the page.
Yeah.
Back to the list, and there was no way.
that's a great question. The question was, is there a way or contact if you want to update your list to Find Help? You can reach out to Find Help directly, or if it's something where you're like, hey, this is really wrong, reach out to me or to Nicolette Wise with social determinants of health and attention. Oh, perfect. Okay. You can take a screenshot of this. There's a couple of ways to contact us. I'll say, in general, it's the Rural Health Association that's sort of sure
that programs are staying up to date. Do you know if the program has like a actual profile within Firefly? Like it's listed on the website, but are you able to log in and view referrals that well,
So there's two different views. So you can go see and search a program. That doesn't mean that your program has access to like have a login to find help. So there's two views here, which, yeah.
yeah, you said, I think you said for your programs, see next step. So you probably wouldn't be able to see referrals that come towards. Start a conversation with Bob. Are there any other questions?
All right, can we say thanks to all of our in person, the technology gods that shined over us in the last couple of hours. So thank you guys for being here online. Thank you guys for being here. That was a lot of information. My brain is just a scooch weary, but it was excellent information, right? And so I think it's important we continue these conversations because there's so much understanding. And I loved what Joanna said, the dots that continue to need to be connected. So let's keep our conversations going. Part of our strategic plan with Resilient Tennessee is to figure out some of this work. So you will continue to hear about this from us as we move forward. So final thoughts, I think that was it. Our last networking of food. If you have the dough plate, there's still a little bit of food. We're happy to send you out of here with food. And there is more plates we can find to put on top of a plate you may take with you. However that works. Have food, have a muffin, have a carrot bar, because those are my favorites. So I need you to take them away. But thank you for being here online. Thank you guys. You're the best. I'll send out follow-up with PDFs of the PowerPoints that I've been given permission to share. The videos will be, I'll send them out in that same email. If you are not on an email list, either email me, melissa.mcgee@tn.gov, or go to tn.gov/TCCY, scroll all the way down and you can sign up for multiple emails. Okay, love you, bye, safe travels.